Let's speak further then about World AIDS Day. Bring in Professor Salim Abdool Karim, an epidemiologist and also director of the Center for the AIDS Program of Research in South Africa. Good to have you on the program this evening, sir. So that report from the Western Cape painting an alarming picture. We were told that more than 100,000 people in the Western Cape who tested positive for HIV have not accessed treatment in the last 2 years. We carried a similar report last night in the Eastern Cape, where the government is now having to embark, Prof, on door-to-door campaigns to encourage people who know their status to actually go to clinics and collect their medication. Why would people who know how life-saving these ARVs can be not collect their treatment?
Good evening to Makila and good evening to all of the viewers. I mean, we saw the sight at the beginning of the HIV epidemic when it was almost a death sentence when you tested positive. And so there was a very serious pushback, there was discrimination, there was stigma that people had to deal with. Now, all of that in that environment has now changed. There's high levels of acceptability. People can come out and live openly with their HIV status, and treatment has been a key part of that because it has changed AIDS from a almost uniform death sentence to one in which you can live quite happily and healthily. Now, what we are seeing is that in our aim to get to the 90-90-90 treatment targets, or the 95-95-95 treatment targets, we had a huge push to increase testing. We had a huge push to try and link individuals to care. And so what happened was that some of the individuals that started care have over time dropped off. Some of that is because they've moved away to somewhere else, or they had side effects of the drugs, or they just got tired of it all. And that's really a problem because you have to take a tablet every day. But we know that right now, if you take our own clinic here in Durban, where we are treating TB patients, quite a high proportion of the TB patients we're seeing who have HIV were initially in care. They were on treatment, and then they just stopped. They just dropped the ball. And they are now going on to getting the adverse effects of not being on treatment, including getting tuberculosis. So we have to re-engage those individuals, and that's what this new government program is attempting to do. It's really quite a laudable goal, not an easy one, but a very important one if we are to achieve our targets by 2030.
And I'll ask you more about the targets in a moment, Prof, but speak to us about what the future looks like then for people who, for the various reasons that you've outlined, are currently not on treatment. You mentioned the risk, for example, of tuberculosis down the line, but ultimately, are we going to see loss of life as a result?
Well, the two big problems that occur when somebody who started treatment then goes on to stop taking their medication. The first thing is that they will now start regressing, and they will basically go back to getting progression to the clinical illness we know as AIDS. And that comes with a whole range of conditions: tuberculosis, cryptococcal meningitis, and so on. And we have started seeing some of those patients presenting with these illnesses. So that's just about your AIDS progressing and moving you towards a possibility of death because you haven't had your treatment. But the second problem for me is equally concerning, and that is that individuals who stop taking their treatment, they can develop drug resistance. So because they stopped taking their treatment, and the drug levels were very low, and the virus was exposed to these low levels of drugs, they can develop resistance. And when they do that, it means that when they start treatment again, they can't go on to the normal first-line, readily available options we have. They've got to go for more complicated, more expensive, more difficult-to-take regimens. So those are the two big problems we deal with.
Do you think, though, as a society, we've stopped taking HIV and then in the worst case scenario, AIDS, as seriously as we used to? I mean, I'm a child of the 90s. Growing up in the late 90s and the 2000s, a lot of the messaging was also anchored around fear. For instance, many of us grew up seeing friends, loved ones die, or being in the process of dying from full-blown AIDS, and that struck the fear of the illness in us, but it was not sustainable, I suppose, as a long-term deterrent, for want of a better word. How do we then come up with more effective messaging now at a time when that simply is not going to work, because there is access to treatment and you no longer are seeing images of people who die of full-blown AIDS?
Temekile, you're absolutely right. So when you backtrack 20 years ago to the early 2000s, and we saw large numbers of people dying, and friends, family members, people we knew at work were succumbing to this illness. And it wasn't, something that they would just quietly get. It was visible. You could see them being eaten away, literally losing weight in front of you and getting quite severely ill. And those days have stayed with many people's memories. They know, they saw it, they experienced it. But the problem we now have is that the newer generations, given that treatment and antiretrovirals have been available in this country for just over 20 years, that there's this whole generation of young people that just didn't see that. They have no experience of it. So for them, what is AIDS? Oh, it's something that you have to take treatment for. So their perception and their understanding of its importance is different. But it's not just that. At a global level, AIDS has dropped in terms of people's attention span and political will. And that's not just a problem of AIDS, it's a problem of many other conditions as well, because the world is facing so many other problems. We've got climate change, we've got wars, we've got conflicts, we've got so many other things, not least COVID-19, that took so much of individuals' attentions away from HIV. So for all of those reasons, in a way, we've sort of lost the emphasis and focus on HIV, which is really, very sad, because now is the time we need to put our foot down and keep going, because we still have a way to go before we can reach the 2030 goals.
And speaking of a way to go, an estimated, I think, 8 million South Africans from the last survey that I had seen, and an estimated 8 million people in this country, South Africa, are said to be living with HIV and AIDS. At the beginning of the year, we had a great many conversations about the withdrawal of US funding for some of the programs that would assist then in the endeavor to keep them healthy. What has been the cost that you've seen in the last few months from that withdrawal of funding?
Well, the US had come to many countries in Africa, including South Africa, to say, we'd like to partner with you in your AIDS response. And literally, South Africa engaged with PEPFAR and the US government, and we created this partnership. And this partnership was built on mutual acceptance of the overall program. And so PEPFAR played quite an important role in certain aspects of it. Fortunately, in South Africa, the South African government had always been paying for the critical elements. For example, all the antiretroviral drugs that are used in this country, they are purchased by the government, the lab tests and the clinical care and so on. PEPFAR was paying for certain things like data collection, like special programs for vulnerable populations, outreach programs, providing some staff. So those activities have now been lost. And as a result, it has now become a little bit more difficult for some people to access care. So, for example, somebody who had a PEPFAR clinic, because most of those were pop-ups, closer to where people were, if that's no longer available, people have a longer bus ride to go to a clinic now to get their treatment. But mostly we've seen that patients have been willing to do that. They know the importance of taking their treatment. But there'll always be a small group that just won't go that extra mile. To them, that's a bridge too far.
Right.
And that's very unfortunate, because that's pushing down our attempts to increase the treatment coverage.
Professor Salim Abdool Karim, good to talk to you, Director of the Centre for the AIDS Programme of Research in South Africa on World AIDS Day.